Introduction. Welcome medical students to today's lecture on the fascinating topic of bariatric surgery and its impact on diabetes remission. As future physicians, it is crucial for you to understand the intricate details of this field, as it continues to evolve and offer new possibilities for patients with diabetes. In this lecture, we will examine various aspects related to bariatric surgery, including its effects on insulin receptor signaling, gut microbiota alterations, genetic determinants of diabetes remission, metabolic effects of different bariatric surgery procedures, inflammation and adipokin changes, neuroendocrine regulation of glucose homeostasis, hepatic and extrahepatic factors in glucose metabolism, cardiovascular outcomes, renal function, predictive biomarkers, nutritional deficiencies, surgical complications, and ultimately, the conclusions that can be drawn from our current understanding. So without further ado, let us dive into this intricate subject matter. Bariatric surgery, a highly effective weight loss intervention for individuals with severe obesity, has proven to have a significant impact on insulin receptor signaling. Within the setting of diabetes, this surgical procedure has been shown to improve insulin sensitivity and promote glycemic control. Mechanistically, bariatric surgery affects insulin receptor signaling by modulating the expression and function of multiple insulin receptor downstream components, including insulin receptor substrate 1, IRS1, IRS2, phosphatidylinosytide 3 kinase, PIEK, protein kinase B, ACT, and glucose transporter 4, GLUT4, among others. These alterations lead to enhanced insulin signaling, increased glucose uptake, and improved glycemic control in patients with diabetes. Various types of bariatric surgery, such as Roux-en-Y gastric bypass, RYGB, and sleeve gastrectomy, SG, have demonstrated differential effects on insulin receptor signaling, potentially influencing the outcomes of diabetes remission. Emerging evidence suggests that alterations in the gut microbiota play a crucial role in the remission of diabetes following bariatric surgery. The gut microbiota is a complex ecosystem of microorganisms residing in the gastrointestinal tract, and it has been shown to modulate various physiological processes, including glucose metabolism. Bariatric surgery induces significant changes in the gut microbiota composition, favoring the growth of beneficial microbial species that produce short-chain fatty acids, SCFAs, and promote intestinal barrier integrity. These SCFAs contribute to improved insulin sensitivity, enhanced glucose metabolism, and overall glucose homeostasis after surgery. Furthermore, the alteration of gut microbiota may also influence the secretion of incretins, such as glucagon-like peptide 1, GLP-1, which are known to regulate insulin secretion and glucose metabolism. Elucidating the intricate relationship between gut microbiota alterations and diabetes remission post-bariatric surgery is fundamental for developing targeted therapeutic strategies in the future. Genetic factors are known to influence the likelihood of achieving diabetes remission after bariatric surgery. Although the precise genetic determinants remain incompletely understood, several studies have identified genes and genetic variants associated with different aspects of diabetes remission. These include genes involved in insulin signaling pathways, pancreatic beta cell function, adipogenesis, appetite regulation, and lipid metabolism. Understanding the genetic underpinnings of diabetes remission will not only provide valuable insights into the mechanisms of surgical success but may also help identify patients who would benefit the most from bariatric surgery as a treatment modality for diabetes. The metabolic effects of bariatric surgery vary depending on the surgical procedure selected. The two most commonly performed procedures, RYGB and SG, have distinct mechanisms of action, leading to differential metabolic outcomes. RYGB involves creating a small gastric pouch and bypassing a portion of the small intestine, effectively reducing the size of the stomach and altering nutrient absorption. This procedure has been associated with significant weight loss, improved glucose control, and increased insulin sensitivity. On the other hand, SG involves removing a large portion of the stomach, resulting in reduced food intake, hormonal changes, and alteration of gut peptide secretion. Both procedures have demonstrated positive metabolic effects, but further research is necessary to determine the long-term sustainability and efficacy of each procedure in achieving diabetes remission. Inflammation and adipokin changes play a crucial role in the metabolic improvements observed after bariatric surgery. Adipokins, such as adiponectin and leptin, are bioactive molecules secreted by adipose tissue that regulate insulin sensitivity, inflammation, and energy balance. Bariatric surgery has been shown to modulate adipokin levels, promoting the secretion of adiponectin and reducing the levels of inflammatory adipokins, such as tumor necrosis factor alpha, TNF-alpha, and interleukin-6, IL-6. The reduction of chronic low-grade inflammation and the restoration of adipocan balance contribute to improved insulin sensitivity and glucose metabolism, ultimately facilitating diabetes remission in patients undergoing bariatric surgery. The neuroendocrine regulation of glucose homeostasis undergoes significant changes following bariatric surgery. The central nervous system, in collaboration with peripheral organs, plays a critical role in maintaining glucose levels within a narrow physiological range. Bariatric surgery affects neuroendocrine pathways involved in appetite regulation, satiety signaling, and energy balance, leading to reduced food intake, increased satiety, and weight loss. Hormonal changes, such as increased secretion of GLP-1 and peptide E, PYY, and decreased levels of ghrelin, contribute to enhanced insulin secretion, improved glycemic control, and, ultimately, diabetes remission post-bariatric surgery. Further research is required to unravel the intricate interactions between the central nervous system and peripheral tissues in the context of glucose homeostasis after surgery. The liver and its interaction with extrahepatic organs play critical roles in glucose metabolism and diabetes remission following bariatric surgery. The liver acts as a central hub for glucose production, storage, and utilization. Bariatric surgery affects hepatic glucose production, resulting in reduced gluconeogenesis and glycogenolysis. Additionally, alterations in the gut-liver axis and adipose-liver communication contribute to improved hepatic insulin sensitivity and overall glucose homeostasis. Understanding the specific molecular mechanisms underlying the impact of bariatric surgery on hepatic and extrahepatic factors is crucial for elucidating the metabolic alterations associated with diabetes remission. Cardiovascular disease is a major cause of morbidity and mortality in patients with diabetes. Bariatric surgery has demonstrated significant benefits on cardiovascular outcomes in these patients. Long-term studies have consistently shown that bariatric surgery leads to improvements in various cardiovascular risk factors, including hypertension, dyslipidemia, and inflammation. Through mechanisms such as weight loss, improved glycemic control, reduced adiposity, and altered adipocan profile, bariatric surgery contributes to a reduction in cardiovascular risk, ultimately leading to better patient outcomes. Future research should focus on elucidating the optimal surgical procedure and the long-term effects on cardiovascular outcomes in patients with diabetes. Renal function plays a crucial role in the response to bariatric surgery and diabetes remission. Patients with diabetes and obesity often exhibit renal impairment, and bariatric surgery has been shown to ameliorate renal dysfunction. Improvements in glomerular filtration rate, GFR, and albuminuria have been observed following bariatric surgery, which may be attributed to weight loss, reduction of inflammation, and improved glycemic control. Although renal function can improve following surgery, careful monitoring is essential, especially in patients with pre-existing kidney disease. Further research is warranted to elucidate the underlying mechanisms and long-term effects of diabetes remission on renal function in bariatric surgery patients. Identifying predictive biomarkers for diabetes remission after bariatric surgery remains an area of intense investigation. The ability to accurately predict patient responses to surgical interventions would allow for personalized treatment strategies and better patient outcomes. Numerous biomarkers have been proposed to predict diabetes remission, including preoperative HbA1c levels, duration of diabetes, insulin resistance indices, genetic factors, gut microbiota composition, and hormonal markers. Combining multiple biomarkers may enhance predictive accuracy, but further research is necessary to validate their efficacy and establish their clinical utility in a larger patient population. Bariatric surgery, while effective for weight loss and diabetes remission, can lead to nutritional deficiencies due to altered nutrient absorption and reduced food intake. Patients undergoing bariatric surgery require lifelong nutritional supplementation and continuous monitoring of nutritional status to ensure adequate intake of essential vitamins, minerals, and macronutrients. Common deficiencies include vitamin B12, iron, calcium, vitamin D, thiamine, and folate. Nutritional deficiencies can have severe consequences if left untreated, including anemia, osteoporosis, neuropathy, and malnutrition. Regular follow-up visits, dietary counseling, and comprehensive nutritional evaluations are essential to optimize patient outcomes and prevent long-term complications. Despite the numerous benefits of bariatric surgery, it is essential to be aware of potential surgical complications and their impact on diabetes remission outcomes. Complications can occur both in the early postoperative period and in the long term. Early complications include surgical site infections, anastomotic leaks, bleeding, and deep vein thrombosis. Long-term complications encompass nutritional deficiencies, gallstones, internal hernias, dumping syndrome, bowel obstructions, and weight regain. These complications can negatively affect patient outcomes, including diabetes remission. Close monitoring, prompt recognition, and appropriate management of surgical complications are imperative to ensure optimal postoperative results. In conclusion, bariatric surgery holds great promise in achieving diabetes remission and improving metabolic outcomes in patients with severe obesity and diabetes. Our exploration of various topics related to bariatric surgery has allowed us to delve into the intricate details of this field. From understanding the impact of surgical procedures on insulin receptor signaling to the role of gut microbiota alterations in diabetes remission, genetic determinants, metabolic effects, inflammation, neuroendocrine regulation, hepatic and extrahepatic factors, cardiovascular outcomes, renal function, predictive biomarkers, nutritional deficiencies, and surgical complications, each aspect is interconnected and shapes the overall outcomes in patients undergoing bariatric surgery for diabetes remission. By broadening our knowledge in this field, we are better equipped to provide comprehensive care and improve patient outcomes for individuals battling severe obesity and diabetes.